conversation. So let's really, I'll look at the... Good evening and welcome back to our show, Brookfield Public Advocate. I'm your host, Bruce Senek. Before we get to tonight's topic, I'd like to tell you about some of the exciting programs we're working on for the future. We'll be doing shows on some of the issues originating out of Town Hall. We'll have some special guest hosts, and we'll continue our Meet the Candidates series with candidates for local offices for election in the fall. Now, tonight we'll discuss an extremely important issue, breast cancer. Everyone knows someone who has suffered from this disease. It could be you, your mom, your wife, your daughter, or in my case, I even had a former male pastor of mine who had breast cancer. Our conversation this evening will be more on screening and early detection, on breast tissue itself, and what you need to know. Our special guest, Nancy Cappello, Ph.D., is on a mission. 8 years ago, she received a diagnosis of stage 3C breast cancer. That was just months after having a mammogram, what she calls her happygram report, which stated everything was normal. Nancy, welcome to Brookfield Public Advocate, and thank you for coming.
Thank you, Bruce.
Please tell our audience a little bit about yourself.
Sure. Well, I'm not going to tell my age, because I'm old enough to know not to tell my age.
Okay.
But I'll tell you that I never thought I would ever be on this mission about breast cancer, dense breast tissue, and preventing later stage cancers. I was actually a resident brought up in Connecticut. I was brought up in Watertown, Connecticut. I graduated from Watertown High School, went on to college, got a degree in education, went back to Watertown, and I taught school for about 14 years. And then I became the director of special education for the school district. And then in my late 30s, I started going to school for my Ph.D. and I went to the State Department of Education. That was my next career in Hartford. I worked there for nearly 20 years. And my passion, other than breasts, what I'm now talking about, is education and how important education is to children, to give them an opportunity to do anything. So education is clearly important. And in this work, I believe that a lot that I've done in my career, my professional career, has really prepared me for this work, because I spent much of my time working with kids with disabilities and kids who have difficulties learning to read. So I look at the work that I'm doing now as giving women, all women, which I never had, access to an early breast cancer diagnosis.
Yeah, educational, that's terrific. Well, like me, you're a cancer survivor. How did you decide to get involved in really such a big way, particularly when, frankly, most people don't?
Well, you know, it's like anything else, and you know this. I was just going around my merry old life. I caught my boring life, and but I was a very faithful patient. I ate healthy, exercised daily. I had no relatives with breast cancer, and I was very diligent in my screening. So I started having my screening, my breast cancer screening at age 40. So I had a decade of what I call normal mammograms, what they called normal mammograms, but they certainly were far from normal. So what happened was I had just had a normal mammogram. I went 6 weeks later for my annual gynecological exam again. Bruce, a very faithful patient. And when my gynecologist was doing a thorough breast exam, she said, you know, Nancy, I feel this ridge in your right breast. I know you just had a normal mammogram, but I feel something. So the standard of care is when you feel something, when something is palpable, you send the patient on for typically another diagnostic mammogram and then an ultrasound. The diagnostic mammogram saw nothing. The same day that the ultrasound picked up a quarter-sized lesion, which metastasized to 13 lymph nodes, was the same day that my mammogram was still normal. And how I got into this is I just could not believe that my cancer was diagnosed at such a late stage, especially the fact that I was doing everything I was told to do.
Supposed to do, right?
So when I asked my doctors, my physicians, what happened? Why didn't the mammogram find the cancer? And this is the first time I heard this term. Well, Nancy, you have dense breast tissue. And I remember, you know, again, being an educator, had my pad, wrote it down, thought, like, what's that? What does it mean? What do I have that prevented my cancer from being found early? And then when I started doing all the research in medical journals, that's what catapulted me to say, oh my God, this is a fatal flaw in the early detection of breast cancer. There are women just like me, 40% of women have dense breast tissue. They typically don't know it. And here they are going every year for their mammogram. It comes back normal, yet they have a hidden intruder, like I had, really stealing my life. And I was darn mad. And I knew, since my docs, when I went back to them and said, well, look what I found. I had all this research, piles of research. Look what I found. I found study after study. Now they're 2 decades old. At the time, they were a decade old. That because when your tissue is dense, it's very difficult for the mammogram to penetrate through that X-ray to find the cancer. So it actually misses every other cancer in dense breast. Well, shouldn't someone have told me this?
Yeah.
And the second thing, there are other tools, such as a simple ultrasound, that can significantly find cancers that mammogram misses. And no one's telling women this. And my doc said, no, we just don't do that. We can't. It's just not the standard protocol. And that's when I said, now again, you understand being a cancer survivor. I was scared. What do I do? First of all, I have late stage cancer. Am I going to live or die? Is this going to kill me? And again, I'm not out of the woods yet. I mean, I read the data. I understand this. You know, early the better. Not a guarantee by 100% by any means, but the earlier the better. So I had to do it. I was compelled to get this information because it gave me a sense of satisfaction that I could at least help others because I can't help myself.
Yeah. Now, we're going to put up at the end of the show your websites, but in preparing for the show, you know, I checked out your websites. Tell the audience a little bit about what your organizational goals are.
Sure. Well, we have 2 organizations. The first organization is called Are You Dense? And the second organization is Are You Dense Advocacy. Our advocacy organization concentrates on our legislative efforts. The mission of Are You Dense and Are You Dense Advocacy is to educate the public about the risks and screening challenges of dense breast tissue and to prevent later stage cancers. And one of the ways, and again, this is what happened to me, that I started figuring out how do I get this information to women since docs were not going to tell them. They told me that, oh no, we can't do that, Nancy. Are you kidding me? I decided the only way that I knew how to do it, and my husband actually, my husband Joe, and this is in 2004 when I was diagnosed, called Senator Joan Hartley and said, can't we do something in Connecticut? Because docs aren't telling women, and what my wife uncovered is unbelievable. It's not only that you can't see the cancer, as you mentioned earlier, you have a greater risk of getting cancer. Well, shouldn't the patient know that?
Yeah. Well, you've described your experience. When I received my diagnosis at age 29, I became very emotional, and you've just related how, I guess, was your first reaction, you know, what's going to happen to me, but then you got mad and went with that. How were you able to process all that was going on, given these conflicting reports and your doctor basically saying, well, you know, we don't do that?
You know, it's so challenging, and all, you know, the audience understands. They know, all your viewers, a lot of them are going through cancer. They know folks who've had cancer, being caregivers. They've lost people to cancer, loved ones to cancer. It's very difficult because I always say this, what was so critically important on February 2nd, 2004 to me, like, you know, I need to get my tires changed, or who's going to, you know, I got to go to the laundromat. How am I going to do all, on February 3rd, the date of my diagnosis, all that stuff meant nothing, as you know.
Yep.
And I was actually focused on living, breathing, absorbing all these. And then all of a sudden you have to learn this whole new culture of medicine. These, you know, I have a Ph.D. and I've learned these like 5-syllable words. I, you know, couldn't even spell, like what? And I'd say to doctors, slow down. I don't understand a word you're saying. Very challenging. There were some very dark days. But again, I have a lot of faith. I believe that you need to count your blessings. I had a lot of blessings. I had a job that people cared for me. I had a family, a husband who loved me. I had insurance that could make, I could go around and get second opinions even. I had choices in who I went to for my health care. So I was very fortunate, and I would always think of counting my blessings every day and naming them, because even though I had a late stage cancer and who knew the future, I knew that I had to really concentrate on what was good and what was blessed in my life.
Yeah. With throughout this process and everything, did you? I know when I had mine, I was at Sloan Kettering. I felt I was on an assembly line. Did you have any of that same feeling?
You do feel that. You want your doctors to treat you, the patient, as his only patient. And there were times, although I have to say, I was very diligent in making sure that I had good care and that my doctors cared for me, and they knew that because, for example, my doctor referred me to a oncologist, and I went to the oncologist, and after spending about 10 minutes with the oncologist, like a dating service, I thought, you're not going to be my oncologist to myself. Sorry, no match here. So I made sure that I was going to go to doctors that I knew cared about Nancy Cappello as much as I think they could care about me.
Right.
I was also very diligent in reading all I could about my own disease. And I wanted to make sure that I was very much a part of any decision making, which my docs liked, because doctors certainly like patients to be informed. But it is challenging, and it's very hard, especially when you're in the middle of that, to then garner all you can to start really fighting. But I felt I was fighting for my life. I had to do it.
Did you feel, now you mentioned, I guess, that you were talking to some oncologist, and maybe there were other physicians involved as well, that, again, you're not really necessarily interviewing them, but did you feel that they were reluctant to listen? And some doctors are reluctant to actually listen or hear what their patients are telling them.
On occasion, sure. And when I finally found an oncologist, I only went through, it's like, how many husbands can you go through? It was only one oncologist I went through, so I don't think I'm like a full-timer.
Okay.
So my second oncologist, when he sat down and we talked about me, Nancy, and he asked me, because I'm again, very health conscious, and what was some of my vitamins I was taking, and we had a real discussion. He was actually listening to me. The phone wasn't ringing. He wasn't running around looking for other things. People weren't interrupting. And after 10 minutes, I was like, where have you been all my life? I want you. So yes, you kind of have this sense of, and I was very fortunate because, again, I had choices. But you do have a sense of who really does care about me as a patient and me as a survivor.
Yeah. Also, in maybe your personal story and maybe other stories, I know you on your websites you have some other stories of other people. Do you feel that a lot of physicians aren't even broaching this subject of dense breast tissue?
Oh, absolutely. I mean, we know by data. I mean, I'm an evidence directs my life. It directs my life. It did as an educator. We need to have data. We need to have evidence. We need to have science. This is all scientific based. It's not just one poor sad sap story and let's feel all bad for Nancy Cappello. I represent the thousands of women nationally. We estimate that there's 45,000 women. That's the size of Wrigley Field Stadium filled. Picture that. Right now, today, that stadium filled with women who within the year had normal mammograms, had the happygram that said, Dear Ms. Cappello, the results of your mammogram are normal. I'm representing those women. And those women have a hidden invasive, that's the killing cancer, and they don't even know it. So yes, doctors have known, radiologists have known about this for years. That's why I uncovered 10 years ago 7 studies with 40,000 women that informed me 40% of women have dense breasts. Mammogram misses every other cancer in dense breasts. There are additional tools such as an ultrasound that can significantly increase cancer detection almost to 98%. Do we ever know this? Did I ever know it? No. And if you have extremely dense tissue, which I had, of course no one told me, you have a 4 to 6 times greater risk of breast cancer than if you had fatty breasts. And the only way to know what your breast density is through your mammogram, and you need to get a copy of your real report if docs aren't telling you about your density. But in Connecticut, we did change that. That was my whole mission at the time. Again, I didn't think I was going to be doing national or international work, Bruce. I was really here to help my sister and my family, my cousins, my community, and my state. I didn't think that women from all over the nation and the world would find me in the same situation as me. Normal mammograms, end up with later stage cancers. They Google dense tissue and they end up with me. And they say, oh my God, that's my story. What can I do in my state? So we're never without women who have been harmed by their density. And again, going back to your question, that doctors have never told them. So our mission is to get this information to women in a standardized way. That it shouldn't depend upon luck, what their zip code is, whether they live or die. It should depend upon getting information and to be able to then make educated decisions based on that information.
Before you started your mission, were there methods of education getting out there, and were they each reaching the audience, or would you say you're really kind of a pioneer in doing this? And I'd like you to give the audience your 2 websites, which again we'll bring it up on the screen later.
Sure.
But
well, the reason why when we first decided, and again we started with working with the Connecticut legislature, we started with a legislation, an insurance bill to cover ultrasound as a screening. This is a good point when you ask, are doctors reluctant? So in 2005, a year after my diagnosis, and I had 2 years. I mean, I'm still in have medication that I take, hormone therapy. But it was 2 years of recovery for me. 7 surgeries, drains hanging. I mean, it was really tough. And so the first year in 2005, we went to Senator Joan Hartley and Senator Joe Crisco, just champions. Gave them the data. We decided to go to insurance, so insurance would cover whole breast ultrasound as a screening. So a woman has a mammogram, her breasts are dense, the doctors know it, her radiologist knows it, her referring doctor, the only one who doesn't know is the woman who has it. So what would happen was, we want women to know it, and then possibly, offering additional screening tools to find cancer. That passed in 2005. I figured, great, I'm done. I have a life, hopefully I'm trying to lead. And I was traveling to Hartford from Woodbury. I mean, a pretty important job, busy job. But here's the thing: docs weren't telling women. Women were going because they heard. I started speaking. People heard about me. Oh, this is the one with the breast who's doing something in Connecticut. They'd asked me to speak, and so as I was asking women about their breast density, women had no idea, even though we had a law. So they started going to their docs. Like, I have a brochure that I made. Are you dense? Right. And they started going to their docs and saying, I want an ultrasound, and docs were refusing to do it. But we have a law. I'm not doing that. Really? Again, I went back. You talk about relentless. I went back to the legislature, Senator Crisco, and Senator Hartley, and said, you can take this legislation and shred it or rip it because docs aren't doing it. We need to get this information in the hands of women, and women will drive this grassroots efforts. Not docs, women. That's why when we named Are You Dense, when we got our logo, the tagline is exposing the best kept secret. We're trying to get this best kept secret to the patient, to women, again, to prevent later stage cancers. Yeah.
Why don't you tell our viewers your websites?
Yeah, 2 websites, areyoudense.org or areyoudenseadvocacy.org, and lots of information, lots of stories from women across the nation and the world. Also information about where our legislative efforts are going. We have a federal bill that we've introduced about a year and a half ago by Congresswoman Rosa DeLauro. We also have information about breast density, how to talk to your docs, information you can bring when you meet with your doc. So it's really about education, outreach, and again, legislative advocacy.
Yeah. Well, what should people do if they learn that they have dense breast tissue?
Well, clearly they should have discussions with their docs and talk about, their own risk factors. And again, density in and of itself is a risk factor. And I would suggest to women that if you have extremely dense breast tissue, or what's called heterogeneously dense, there's 4 stages of density, 1 to 4, 4 being the highest. When I went back and got all my reports, I got the happygram that said I'm fine, and I said, how could I be fine? 6 weeks later, the day my quarter-sized lesion, which metastasized to 13 lymph nodes, I had a normal mammogram. So little did I know there was another report generated by the docs, radiologists, to your referring doc, which included density. So when I went back and got those reports, every year, extremely dense breast, extremely dense breast. So I had extremely dense breast, never knew it, never knew it was a risk factor, never knew that my mammogram was compromised because of it. So it's important, again, for women to have that information so they can actually talk about additional screening tools such as an ultrasound.
Gee, you know, it kind of amazes me that if the reports, again, which you didn't see and which patients don't see, extremely dense year after year, I would think just the nature of doctors would be some kind of follow-up exam.
Wouldn't you think?
I would think, particularly in our litigious society, that they would want to cover themselves.
Well, you know, I've been doing this for 8 years now, nearly 9, and I will say that in the 8 years, you know, when we first brought this to the Connecticut legislature, the Society of Radiologists fought us. They were against the bill. They testified against the bill.
No kidding.
Oh, absolutely. No, we're going to scare women. They're going to make them scare. You want to know how scared I was? You know how I want to know how anxious women are when they get diagnosed with a later stage cancer and their families? Very anxious. And so that was, you talk about drama, but the interesting story is, and this is a testament to evidence in science. Fast forward, when we went in 2007, I went back to the legislature and said we have to do something different. This is crazy. Doctors are refusing to do this. So in 2007, we started again on our journey to get this information to women. 2008, it takes a lot of time and a lot of energy to pass bills. But in 2008, the Society of Radiologists spoke out against the bill. 3 years later, we have doctors that are champions now in Connecticut and are showing the significant increase of early cancers, small, that I never had an opportunity to have, and that are now on our side and are championing our work. So we did turn many doctors around because of the evidence of increased cancer.
Yeah. I would like to have slides 3 and 4 go up if they already haven't. In doing research for our show, I learned that women with dense breasts who have had breast cancer have a 4 times higher risk of recurrence than women with less dense breasts. I don't know if there's any evidence one way or the other, but in your opinion, is this a possible reason why many women choose to have a double mastectomy?
I think what happens is when women, you know, when you're diagnosed with breast cancer, you have to make a lot of decisions. You know, what kind of surgery? Who do I go to? What do I do? What does this mean? You have to learn a lot of new jargon. And I think a lot of women, when they end up having other tests and they may find a suspicious lesion somewhere else, they don't know if it's cancer or not, we may want to do a biopsy. A lot of women just say, you know what, just take the damn breast or breasts. And again, I know that you know, that having mastectomies are up, and I know there's a lot of concern in the medical field about the expense of that. But again, women have to make that decision based on their own age, risk factors, and fear of getting it back. Nobody wants to have it back, clearly.
Well, we're coming towards the end of our
show.
Yeah. Well,
come on, put us on for another half hour.
Well, we'll have you back and do another show.
Oh, my word.
But as I say, we are kind of coming to the end. Is there one last thing that you'd like to leave with our viewers today?
Well, I guess I would say that, you know, it's important for your viewers, to really understand if they ever get a diagnosis, whether it's heart disease or cancer. There's so many things that people need to do to keep healthy, first of all. I know that I had a lot of surgeries, and I've had a lot of doctors say, Nancy, your recovery was much easier because even though I had cancer, I was physically fit, maybe not mentally fit, but physically fit. You know, I would say just to be smart and do as much reading as you can and ask questions. Make your doctors accountable. Bring your little notebook and ask them, you know, how do you handle this? And your time is valuable too. It's not just their time, it's your time too.
Yeah. No, I'm all for asking questions. That's one reason why we have the show, to ask questions, and sometimes you have to ask questions that are uncomfortable. And, you know, you're their patient, they need to inform you and you know, do the best job and a better job than they've been doing, certainly. Well, we're going to wrap up our show now. Again, I'd like to thank tonight's special guest, Nancy M. Cappello, Ph.D., who's the president and founder of Are You Dense? Thank you for appearing.
Thank you, Bruce. This has been wonderful.
I want to remind our viewers that our air dates on Charter Channel 21 are Mondays at 4:30 and Thursdays at 7 p.m. We also post segments of our shows up on YouTube. We'd love to hear from you, whether it be comments on this show or prior shows, guests maybe you'd like to see, or topics that you'd like to have us do. Again, you can contact us at brookfieldpublicadvocate@yahoo.com. Again, thanks for watching and good night.